Now, whether you call it bloating, stomach bloating, or trapped wind, they are all the same thing. And in this week's video, we're going to learn how to get rid of bloating and what causes that stomach bloating. So let's begin. So welcome to my channel. If you haven't been here before, we talk about everything medical and healthcare to keep you healthy and happy. Now, please, if you find any piece of information in this video helpful, don't forget to click that like button because it's going to help me, it's going to help the video, and it's going to help the video grow to a larger audience so more people can find the information on bloating so it can help them too. Now, as always, with every single video, we are going to chapter it all in the description below. So if you want to find any specific piece of information, feel free to click on that chapter on the description and click on the chapter that's relevant to you. Now, let's begin with the signs and symptoms of bloating. I promise I'm going to keep this bit short. Look, bloating can be embarrassing, but remember that everyone suffers from it. We all do from time to time. When we eat, when we chew, when we swallow food, when we swallow drinks, we're always taking in air, and this air can lead to it getting trapped in our stomach. Sometimes as well, certain foods that we eat can cause carbon dioxide releasing as well from the stomach acid, and as a result, all that gas is there in your stomach, and it causes that bloating, that unpleasant feeling that we all get with the trapped wind, basically. Sometimes we let it out when we burp, but sometimes it just gets stuck there, and it leads to that unpleasant feeling where your tummy just feels, really discomforted, really, and then you have to open your bell or do whatever to try and get rid of this bloating that's making you feel so uncomfortable. Now, bloating can quite often happen to us after we've had a large meal or have eaten way too quickly. Common times to experience it can be after a big holiday or wedding feast or on celebratory weekends, but it can also happen to anyone after any regular meal as well. Now, earlier I mentioned two common causes of bloating. One is swallowing air and the other is from actual certain foods that we have that cause carbon dioxide to be released, which causes the bloating. But another common cause of bloating is by our gut biome, and gut biome is a fancy way of saying our gut bacteria, and we have trillions of bacteria within our digestive system, and they all help us in digesting certain foods and absorbing certain vitamins, so we need them as much as they need us, if that makes sense. Now, certain bacteria release quite a lot of gas as well when we have certain foods like cauliflower onions, for example, and then we get that bloating with it as well. But there are other bacteria as well, which we are going to discuss, which is all about having good gut biome, and having a good gut biome, so good gut bacteria, can reduce our bloating as well. So it might be a case that you've got loads of bad bacteria within your gut from having a poor diet, having really bad foods, fast foods, takeaways, we're going to go through all of that. I'm not going to tell you all about that yet. This is just symptoms, but we're going to go through how to improve your gut biome as well, but this can be a common cause of it as well. And alongside all of these, certain medical conditions as well can increase your risk of getting bloated. For example, if you have acid reflux, if you have constipation quite regularly, if you've got celiac disease, if you've got any IBD, IBS, all of these can increase your risk and chance of getting bloated and getting that trapped wind. So these can also be causes, and I will leave more information about them in the description below. Okay, so now that we know all about the signs and symptoms of bloating and what causes it, let's begin with what you can do to get rid of bloating. So tip number one. Tip number one is the easiest tip that everyone can do, and this is to have a nice glass of warm water. And I know it sounds simple. You're gonna think, Abraham, that sounds really simple, but believe me, having a glass of warm water can be really helpful for bloating. So what it does is it causes that peristaltic motion within our digestive tract. So our intestines, when we say peristaltic motion, it's like this basically. If you think this is your intestine and it squeezes and then the next one squeezes and then the next one squeezes, and it helps the food transit through the digestive tract, okay? That is peristaltic motion, a very basic explanation of it. But when we have a nice warm glass of water, it doesn't have to be super hot either, just a normal warm glass of water, it's going to help get that peristaltic motion movement, okay? So if there's any food in our gut, it's going to help send it down. It's going to help send it down, which is going to help relieve that bloating, okay? Imagine a balloon, for example, and it's a massive balloon, and you're just holding the end of it, and there's all this space left, okay? By us having that warm water, it's going to get that peristaltic motion, and the balloon's going to be able to get bigger, so it's going to have a larger area to fill, which is not going to make you feel all trapped, windy, and bloated, and horrible, and uncomfortable, okay? So that's tip number one. Now, some people also find that drinking herbal teas such as chamomile or ginger tea can also ease any discomfort. Now, studies have shown that they may improve digestion and as a result can help reduce the production of wind, which is going to cause the bloating, of course. Peppermint, chamomile and ginger, dandelion and fennel are all great options, with some studies suggesting fennel may be the most beneficial for wind relief. Now moving on to tip number 2. Tip number 2 is all about gently massaging the area, and the studies have been shown that by gently massaging the area, it's going to help that trapped wind move from the area where it's trapped. It's going to help that peristaltic movement that we just spoke about happen to get rid of that trapped wind. When I say massaging the area, it's not a deep examination type massage if you want to think of it. I'll show you actually. So what I mean by massage is just very gently rubbing along the abdominal area, okay? We're not squeezing deep into it like we're doing an examination in the GP office, okay? It's just going to be very, very relaxed, nice, calm massage on the area. As you can see, I'm not pushing firmly. It's very gentle, okay? And this motion is just going to help that trapped wind move along, and it's going to help get rid of that trapped wind. This can be very effective if you've got trapped wind or bloating. Now please do remember that this technique is not suitable for certain individuals, such as those who are pregnant, anyone with a wound in this area, and also anybody with inflammatory bowel disease. Okay, so moving on to tip number 3. All these tips so far, by the way, are things that anyone can do. I like to order it in this way just so it's easier for you before we go into medical treatments and medicines and all that sort of stuff that you might not have to hand, okay? So tip number 3 is all about going for a gentle walk. Remember, the most important thing that we're trying to do here is get that peristaltic motion moving, okay? We want the intestines to start moving the air along, moving the food along, moving the waste products along to get rid of that bloating and trapped wind. So going for a nice easy stroll is a perfect thing to do as well. Think about it. If you're sat down, right, like me right now, so you can see that this sort of angle that my body is in is not a normal angle for our body to be in, and it's gonna cause that bloating as well, because it's causing that pressure on the abdomen. By standing up, for example, all that pressure is gonna get relieved all of a sudden, and going for a walk is gonna help that peristaltic motion happen as well. We know that this happens, and it's gonna help with the bloating. It's a really simple thing to do, but it can be really, really effective. Now the other good news about going for a walk or doing some sort of simple exercise like this is it also helps prevent bloating from happening in the first place. It's going to mean that that peristaltic motion, our guts are going to be moving more often, which is going to reduce the chances of you having bloating or trapped wind at all, okay? I hope that makes sense. Now moving on to tip number 4. Look, if 1, 2 and 3 haven't worked, tip number 4 is when we start looking at medicines, okay? In terms of medication, it's always super important that you speak to your healthcare professional so they can ask you the relevant questions, do the relevant examinations to find out exactly what is causing the bloating. Now, if you speak to them and everything's fine, they might recommend to you a medication either called dimetacone or simetacone. Notice that they both end in ticone, okay? They both work in the same way. The best way to describe to you how these medications work is they help make bubbles smaller. Imagine you have bubble bath, okay, and it's got massive bubbles, okay. These massive bubbles, imagine them inside you now. When they're big and massive, it's going to cause that bloating, okay, because they're going to cause more area that they require, which is going to cause that bloating and trapped wind. Now what simetacone and dimetacone do is they make these bubbles nice and small, okay. So imagine, I don't know, a fizzy drink that you've just poured and you can see all the little bubbles coming out. We're talking about that sort of size, okay? So by having this medication, it causes them bubbles to become tiny, and it helps with the bloating. So it's going to make up less area, the bubbles and the bloating and the gas, which then causes less discomfort, okay? These medications have been used for years, and also they're used in babies as well who have like colic and you know, digestive symptoms and stuff like that. We use them in babies as well, but they're commonly used in adults as well. So I hope that made sense. But the most important thing is, 1, you always speak to your healthcare professional, and 2, you always read the information leaflet that comes with any medication, just so you can make sure that you're safe and suitable to take it. Now, whilst we're on the topic of simetacone and dimetacone, another thing that I wanted to mention is sometimes when you speak to your healthcare professional, they might actually think there's an element of acid reflux as well. Now, with simetacone, for example, you can get it as a tablet form, a capsule form, but you can also get it as a mixture, as an oral liquid, which also contains, you know, an antacid, or, you know, something that's going to help reduce the acid reflux, something that's going to help neutralize the acid or cause a barrier, like a raft forming barrier on top of the acid, plus the simetacone, which is going to help reduce the bubbles and the discomfort caused by the trapped wind. So bear that in mind as well, that them products do exist as well. So again, speak to your healthcare professional about these and make them aware that you've read up or heard about it from YouTube, and see what they think about it for you as well. Now moving on to tip number 5. This section of the video is probably my favorite part of the video for bloating. Reason being is, look, with the other stuff that we spoke about, tip 1 to 4, we are just masking the symptoms, okay? So if you have bloating, we're just masking the symptoms. So we're trying to do something to try and reduce those symptoms that you keep getting, okay, that are ongoing. So, with medicine, we need to find out what the root cause is. This is one of the most important things that I always say to all my patients. We need to find out what is causing this, okay? Whether it's bloating, whether it's a skin condition, you know, whatever it is, we need to find out what the cause is, because all we're doing is just masking these symptoms. So, tip number 5 is all about finding out what is causing the bloating. So, the best thing that I would advise for this is to keep a diary. Keep a diary in your phone. We've all got one of these bad boys these days. You don't need to carry a pen and paper with you anymore. By the way, if you want to carry a pen and paper with you, by all means do that. But we can all put notes on our phone. Put notes on your phone with date, time, what you've eaten and how you're feeling half an hour to an hour afterwards in terms of your bloating, okay? Then we can then look at it and try and correlate actually what's causing it. Maybe, you know, on an evening you are having some sort of spicy food, for example, that every time you have that, it causes your bloating, that makes your bloating really bad. Or for example, you know, in the evening you're having some fizzy drinks, okay, some really sugary fizzy drinks, and that's causing you bloating. Or you're having a glass of milk in the morning and then it causes this bloating, okay? So by doing this, we're going to be able to pinpoint what the cause is and take it out, okay? You see what I did there? We take it out, okay? So if you can do that, this is one of the best things that you can possibly do, because you're going to find out exactly what the cause is, stop it, and all of a sudden you're going to be bloat free. So tip number 5 is probably one of my favorite tips, but it takes time, okay? And I appreciate it takes time, and a lot of people just want a quick fix. But with this sort of stuff, we need to find out what's causing it. So it's important that you try it, see if it works for you, and if you find out what the cause is, leave a comment below and let me know as well. And other people might read it and think, actually, that causes it for me as well, and I'm gonna try and take that out and see how I react to it. And moving on to tip number 6, okay? Tip number 6 is also one of my favorites. Again, this is preventative stuff that we're talking about now. So, as we mentioned at the start of the video, we spoke a little about gut biome and explained that to you. So, with gut biome, I feel like certain foods, for example, the vegetables like cauliflower, broccoli, onions, beans, they all get a bit of a bad stick for bloating, and some of them do cause it for certain people, especially beans, for example. If you're having a lot of beans, you might be getting a lot of bloating because of the gas produced. However, one of the things that we don't talk about much is gut biome and our gut bacteria. And this is something that's relatively new in the medical world. I mean, we've known about gut biome for ages, by the way, and bacteria, but linking it to different conditions, okay? And there's more and more research coming out about gut bacteria and having good gut bacteria within our system, which helps, you know, it helps with, for example, recently it's been shown that gut biome helps with stress and anxiety disorders, and gut biome has been linked to certain cardiovascular diseases, okay? So there's loads of things that gut biome is now being linked to. So the reason I'm rambling on about gut biome is it's important for us to have a good and healthy gut biome, okay? And now you're gonna think to yourself, well, how do I have a good gut biome, Abraham? What should I do for that? Well, I'm gonna tell you a bit about it. But if I tell you everything, this video is gonna be about 2 hours long, okay? So it is gonna require a bit of research that you're gonna have to do on your own as well. First of all, in terms of having a good gut biome, sorry, I can't speak, we need to reduce our sugar intake, okay? If you're having loads and loads of biscuits, cakes, you know, loads of bread, for example, even bread becomes sugar, you know, carbohydrates become sugar, loads of pasta all the time, if you're having loads of rice all the time, if you're having loads of fizzy drinks, okay, if you're having loads of milk, all of these can potentially make our gut biome worse. And when our gut biome is bad, so bad bacteria increases, it can cause these symptoms like indigestion, bloating, all this sort of stuff as well. So one of the things that you can do is try and improve your gut biome. And what we need to do is firstly, reduce our sugar intake massively, okay? So if you're always suffering from bloating and you spoke to your doctor and you spoke to your healthcare professionals and they're all saying everything's fine, but we can't find the cause of it, so we don't know, look into your gut biome and look into what you can do to try and improve your gut bacteria, okay? So first of all, you can reduce your sugar intake. This can be really, really helpful. And like I said, biscuits, all that sort of stuff, you need to quit them. Quit them all, see how it affects you, okay? Reduce the amount of carbohydrates that you're having as well. These sort of refined carbohydrates that we're having, like breads and you know, pasta, rice, all that sort of stuff, all of these do turn into sugar as well, and they can then cause bad gut biome, which can then lead to leaky gut syndrome, okay? And this is where I feel like I'm rambling a lot now, but leaky gut syndrome is basically where the cells that hold our intestines, basically, they sort of get a gap between them and toxins come out of them, and this all causes that inflammation that we don't want, and this inflammation could potentially then cause the gut biome. So we need to reduce our sugar intake. You can also look at potentially stopping milk. Milk can actually cause a lot of bloating, because I think about 70% of us are lactose intolerant. So that can cause the indigestion, all those tummy pain and stuff. Think about if you're having a lot of dairy, try and quit it. Try and use dairy alternatives if you want, but you don't need the dairy for, you know, the calcium and all that sort of stuff. As long as you're having lots of fish, like bony fish, like mackerel, salmon, that sort of stuff, you're going to get enough calcium from it. And by having your 5 a day, your fruit and vegetables, all of them contain some calcium in them as well. So don't think that if you're going to stop milk and dairy, all of a sudden you're going to become calcium depleted, because as long as you're having a healthy, balanced diet of everything else, you're going to get enough calcium. Okay, so reducing the sugars, reducing the milk intake, these could be very beneficial for your gut biome. And give that a whirl. Do a bit of research yourself, because even right now, how long has that been? I think it's been like 3 minutes that I've been talking about gut biome. Even right now, it's getting quite long, all this information. So do some research on how to improve your gut biome, and also look at eating foods that are good for the gut bacteria, so prebiotic type foods. So for example, like pomegranates are really good sort of prebiotic foods, and prebiotics are basically nutrition, the probiotics are the good bacteria, okay? So definitely look at having more pomegranates, stuff like that. They can be really good prebiotics, but don't go to the supermarket and buy, you know, the little bottles and little white bottles that have got probiotics in them, because they're full of dairy and they're full of sugar, okay? They're not really good probiotics then. If you want to buy some good probiotics, have a good bit of research and find the good stuff that isn't the supermarket stuff, because that is full of sugar, okay, and it's not really going to help with all these sort of indigestion symptoms. So basically what I'm trying to say is improve your gut biome, and you could see a massive difference in these bloating symptoms. I know a lot of my patients who I speak to about doing this, and they make these changes, they see some significant changes, and one of them, just by reducing their gluten intake, so for example their bread intake, can have a massive effect as well. That doesn't mean that they're celiac, by the way, by reducing their gluten, because a lot of them aren't, but just by reducing it and reducing that sugar content that we get, you can see a benefit in the good gut biome that increases and the bad one reduces, okay? So give that a whirl. I hope that all made sense. So moving on to when you should seek medical attention. Look, first of all, if you haven't suffered from bloating before and you've all of a sudden randomly got it, you should speak to your healthcare professional. This is super important, just so you can find out exactly what's causing it, okay? Another thing I want to mention is if you feel like you're lactose intolerant, or you've got celiac or anything like that, so if you have any milk and it's causing you bloating and these discomfort and indigestion type symptoms, if you're having any gluten and it's causing those sort of symptoms, again, you need to speak to your healthcare professional, because they need to investigate and find out, is that the cause for it, and what do we need to do about it? So this is super important. Don't just leave it and think, okay, let's just see and try these techniques and see if it helps. You need to speak to a healthcare professional. Another thing that I want to discuss is constipation. If you feel like you're always getting constipated, again, speak to your healthcare professional. Don't just leave it. Look, the bowels and these sort of conditions, it's really important that they get checked out, because bowel cancer is on the rise, and just by you getting it checked out, you're gonna have that ease of mind just to make sure nothing sinister is happening that's causing it, because it can sometimes be a link to it. And I don't want to scare you, but that's the importance of speaking to your healthcare professional. Now, a few of the red flags that I want to talk to you about, if you have any of these sort of symptoms as well, speak to your healthcare professional urgently. So first of all, if you're losing weight, if you aren't losing weight without trying to lose weight, okay, or if you're having a bit of food and you're suddenly full, okay, these are symptoms that you should speak to a healthcare professional urgently about. So, but how do you know if you're losing weight? All of a sudden your clothes feel really loose on you and you haven't been trying to lose weight, you've lost weight, okay? Or if anyone tells you, actually, you look like you've lost a lot of weight, is everything okay? These are signs that you should be speaking to a healthcare professional. Secondly, if you are having any difficulty swallowing, if all of a sudden when you're having water you're choking on it, if all of a sudden when you're eating food you're choking on it, you're having any difficulty swallowing, speak to your healthcare professional. Thirdly, if you have noticed any change in your bowel habits, or you feel like your poo has changed shape and consistency and it's constantly like that, or it's got any mucus in it or any blood, speak to your healthcare professional. These sort of symptoms are what we call red flags, and it should be checked out as soon as possible. Okay, so it looks like we've come to the end of this week's video. I really hope that you found this information helpful. We now know all about bloating, we now know about the causes, we now know about the symptoms of bloating, the causes of bloating, I said that twice. We now know about how to get rid of bloating and how to prevent bloating, and we now know all about the gut biome, which I rambled about for a long time about to you guys. If you guys want a video on gut biome, by the way, please leave some comments below and let me know, and we can do a full video on different things that you can do to help improve your gut biome, because I feel like we're getting quite a few messages about it now and it's starting to become a big topic. But if you want more information on it, please do let me know and I will quite happily make a video on it. I really hope that you found this information helpful. As I said at the start, if you find any of this information helpful and it was new to you, please don't forget to click that like button, because it's going to help me, it's going to help the video grow, and like I said, it's going to help it grow to a larger audience so more people can see it, more people can learn about what to do, and it can help them too. Also, if you have any of your own tips, don't forget to leave a comment below, because I'd love to read it and I'm sure everyone watching would love to read it too. As always, sending you awesome vibes, and always remember, you're awesome. So if you suddenly feel like you've lost weight and people are looking at you and they're like, mate, you've lost weight, okay? You need to speak to your doctor. Any change in your stools, any change in your poo, I mean, can we say poo? Is that a bad word to say? I feel like more people know that word to stools. It's probably easier for... So we now know about bloating, we know about bloating causes, we know about the causes of bloating, and I said it twice again. I need to stop saying things twice. It's gonna help the video grow, and it's gonna help the video grow to a blah, 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 blah. Hey guys, thanks for watching this week's video. Make sure to click that like, follow, or subscribe button now to stay up to date with new weekly videos.